So welcome everybody back to another OAO member spotlight. And today I'm pleased to have Dr. Vishakha Thakrar. Welcome, Vishakha.
Thanks, Jeff, for having me.
Well, you're welcome. For those who don't know, Vishakha runs a private practice, a specialty contact lens private practice in Vaughan, Ontario. But she has just recently expanded where she offers these services into Kensington Eye Institute in downtown Toronto. So Vishakha, maybe you can explain to folks first what Kensington Eye Institute is, because not everybody watching would know.
So Kensington Eye Institute really came about when the Ontario government several years ago, Jeff, you might even know the dates better than me, decided that they wanted to do something about the cataract wait times. And they approached a group of ophthalmologists, and from that, Kensington Eye Institute came into place. It is currently my belief that it's affiliated with the University Health Network, and it's more from just cataract surgery. They have a glaucoma service, they have a retinal service, cornea service, and obviously now the therapeutic contact lens clinic. The background to that and how this contact lens clinic opened was Dr. Alan Slomovic, who is a corneal specialist at Kensington, and his base is Toronto Western Hospital, which is part of the University Health Network. He wanted to collaborate optometry and ophthalmology. And with cornea, that's really important because corneal specialists, they see all these patients, but many of them cannot see without contact lenses. And he truly recognized that. And so he approached Sharif El-Dafrawi, who's the chief of Kensington Eye Institute, and to really see, is this something that we can open within this facility? And from that point on, he contacted Dr. Jennifer Liao, Dr. Barb Caffrey, and myself to work together based on our background, our expertise in fitting contact lenses, to see if we could put together an advanced contact lens clinic.
Right. Okay. So there's 3 ODs then that are now offering specialty contact lens fits inside Kensington.
Exactly.
So what type of patients are you seeing? Obviously, you're seeing, specialty contact lens fits in Vaughan at your private practice. Mm-hmm. What's different about the set of patients that you're seeing in Kensington?
So, many of the patients that we see at Kensington Eye Institute may be similar to the referrals I get in Vaughan. And I'll tell you what that is specifically. So it could be any type of corneal disease, whether it's an irregular cornea, keratoconus, transplants, but moving on to ocular surface disease like ocular cicatricial pemphigoid, Stevens-Johnson's. The amazing thing about Kensington Eye Institute is because we're working so closely with ophthalmology, we have the opportunity to really see patients that we may not see in our private practices, the patients that the ophthalmologists have traditionally held on to. By developing this relationship, I feel that they've developed a confidence in us to attempt and to fit these more severe patients.
So are most of your referrals to date coming from within Kensington from ophthalmology, or are you getting some from optometry?
So I think we're getting most of them from ophthalmology, particularly corneal specialists, but it's not even so much just from Kensington. It's from, St. Mike's, Toronto Western, private clinics. And we are getting some from optometry as well. That part definitely needs to grow. After the Walter Wright Symposium back in December, there were several optometrists there, and that's when the optometry referrals started to grow more so.
So Vishakha, can an optometrist refer directly to you within the clinic, or do they need to send it to an ophthalmologist first within Kensington, or can they send to you?
No, so they can send directly to the clinic. It is a referral center, so we don't see any normal patients. We only see specialty contact lens patients. In terms of who they address it to, they can write specialty contact lens clinic. They can write Dr. Thakrar, Dr. Caffrey, Dr. Liao. It doesn't matter. At that point, the front desk would contact the patient directly and give them information on the specialty contact lens clinic so they can decide whether they want to proceed with their fitting.
How valuable has this relationship been to sort of, the profession of optometry in general?
So, this particular relationship, I can speak from my own experience that everything that I've done in my career thus far has been enhanced with respect to scope because of these types of relationships. So the types of patients I see in my own practice, the types of patients I see at Kensington and we all see continue to grow and to challenge us as optometrists with respect to the disease that we see. And that benefits our patients more than anybody. So if we can continue to grow the relationship between optometry and ophthalmology, then I think it benefits both professions. But again, the patient benefits more than anything else.
Right, exactly. Great point. So what tips would you give to an OD out there who wants to strengthen their collaboration with their local ophthalmology community?
I think that really communication is key. So we need to get out there. And even associates, I mean, when an associate joins a practice, they're trying to build that practice. They need to really try to get out there and meet the local ophthalmologist, whether it's going to the social events like, dinners with CE, going to even small ophthalmology meetings and introducing yourself, giving them the opportunity to know what you are capable of doing. But inside of the practice itself, when I think about the referral letters I write, I try to be as meticulous as possible. I try to give as much information as I can to aid the ophthalmologist because we are the ones who establish that relationship with the patient. The ophthalmologist has limited time. And as you know, they're going through, a patient every minute or two. And so we are there to allow our patient to have the best transition possible with that ophthalmologist. And so communication to them through us is key.
No, that's great. No, I think, and like you said before, it all comes down to better patient care.
Absolutely. It does.
So thanks, Vishakha. Thank you so much for sharing this new venture of your specialty contact lens practice within an ophthalmology center. I think it's groundbreaking in Ontario, and I think it's wonderful that you came on today to share this with your colleagues. So thank you very much.
Thank you, Jeff. You know what? I am so excited about this venture because it is something that is, been done in the United States for a long time, and I think that this is a step forward at least in Ontario. I can't speak for Canada, but at least in Ontario to have something like this in a more hospital-based setting. So thank you.
Agreed completely. Thanks again.